Have you ever found yourself holding a menu or a book just a little further away to read it clearly? Perhaps you are noticing that small print is becoming more challenging, even in good light. It is a very common experience for many of us as we get a little older. This common change, where your eyes lose the ability to focus on close objects, is called presbyopia, and it happens because the natural lens inside your eye gradually loses its elasticity over time. It is a normal, unavoidable part of the aging process for almost everyone. Your eye has an amazing natural lens, located just behind your iris, the colored part of your eye. This lens is designed to be incredibly flexible, able to change shape almost instantly to help you focus on objects at different distances. This ability to change shape is called accommodation. Tiny muscles, known as ciliary muscles, surround the lens and are connected to it by delicate fibers called suspensory ligaments. When you look at something up close, these ciliary muscles contract, relaxing the tension on the suspensory ligaments. This allows the lens, which is naturally elastic, to bulge and become rounder, increasing its focusing power to bring near objects into sharp view. However, as the years go by, the proteins within the lens itself begin to stiffen and harden. Think of it like a fresh, pliable piece of plastic wrap slowly becoming a rigid piece of plastic. This means the lens can no longer easily bulge and change shape, even when the ciliary muscles are working their hardest. The muscles might still be strong, but the lens simply loses its youthful springiness. This gradual hardening of the lens is the primary reason why near vision becomes blurry. While you cannot stop this natural process, there are many effective ways to manage presbyopia and restore your clear near vision. The most common solutions include simple reading glasses, which provide the extra magnification your lens can no longer achieve on its own. Other options include bifocal or progressive lenses, which offer multiple focusing powers in one pair of glasses. Contact lens wearers might explore multifocal contact lenses, or a technique called monovision, where one eye is corrected for distance and the other for near vision. Consulting with your eye care professional is always the best first step to find the solution that perfectly fits your lifestyle and visual needs. This condition typically starts to become noticeable in our early to mid-40s and progresses gradually into our 60s. It is important to understand that presbyopia is not an eye disease, nor is it a sign of poor eye health. It is simply a physiological change, similar to how hair might gray or skin might wrinkle as we age. In fact, everyone experiences some degree of presbyopia, regardless of whether they have had perfect vision their entire lives or have worn glasses since childhood. The key term here is lenticular sclerosis, which refers to the hardening of the lens that causes this change. So, while the loss of lens elasticity is an inevitable part of aging, it does not mean you have to struggle with blurry near vision. With the right corrective lenses or vision solutions, you can continue to enjoy reading, working on your computer, and performing all your daily close-up tasks with comfort and clarity. Maintaining regular exams will ensure you receive the most appropriate and up-to-date guidance for your vision as it changes over time.